stipulate how they have to have nutrition standards for their campus. They have to have physical activity standards. Those nutrition standards include all the foods outside of the meal program. They also have to take a look at how they're promoting wellness policies, or how they're promoting wellness in their school environment, and they have to bring together community members, teachers, food service staff, and administrators to make sure that that wellness policy is actually being implemented. In our early child care domain, child care professionals are doing everything from really building on healthy eating and physical activity by encouraging the adoption of wellness policies similar to the schools. They're also working on farm to preschool models. Our community domain is really trying to engage the community in this conversation by training them how to do nutrition and physical activity assessments in their community that identify problem areas, and then teaching them how to advocate, whether it's with their city council members or with their school board or with any other decision makers in their community to make substantial changes. In the city of Chula Vista, students there were trained how to do a community needs assessment, and they advocated for changes in their park, which they put in new lighting, they put in new sidewalks, and also access to water. In La Mesa, they were able to help install a sidewalk for the local school. We're also looking to see where the summer meal program is taking place in San Diego and where we can expand that program and improve the quality of the food served in the summer meal program. And basically that's just an extension of the school meal program itself. It's ensuring that kids outside of the school year still have access to a free meal. In media, we're really trying to reshape this issue and how they address childhood obesity. It has been primarily focused on individual behavior change and will camp parents, again, just feed them better? Well, a lot of times their environment doesn't support that, so making sure that media really talks about this issue and its complex factors. In business, because there's a variety of different partners at the table, we're working with them to see what their role can be in this issue. So it's everything from making sure farmers markets are food stamp accessible and in the neighborhoods that need more access to healthful foods, to working with restaurants to make sure that they provide healthy alternatives for children and that the default items aren't soda and french fries, but healthier options like milk, water, or fruits and vegetables. So that's kind of a broad overview of my organization and how we've gotten involved in this issue. Our work focuses primarily on nutrition and physical activity and how we can make those options more readily available throughout the community. So I kind of wanted to use that as a framework for setting up food justice, and how does that overlap with public health and the new initiatives and paradigm that has been set up. I kind of just made up this definition, so you may define it a little bit differently. You know, just looking at different food justice definitions that are out there, but what I equate it to is food justice is equitability in all parts of the food system. The grower, processor, distributor, retailer, consumer, and waste disposers receive a fair fiscal and health exchange for their respective contributions.
Left out the workers.
Growers. I meant farmers and farm workers, but good catch. And basically what I meant by a fair fiscal and health exchange is that it not only doesn't deteriorate their health, it promotes their health, it also gives them the biggest bang for their buck financially, that they're paid a fair wage for their services, or they're not paying outrageous or egregious amounts for the food that they're trying to access. So can we make gains in public health without a just food system? Unfortunately, yes and no. Many times we've really gone about this issue in the past of kind of putting a band-aid on the issue, that we haven't really gone about it as systems change. And I think that that's where our mindset is shifting. We're kind of realizing right now that we don't have the luxury of just making a quick fix, even though we may be drawn to make that. That if we really want a healthy food system or a healthy society, we have to change it from the core out. So what does that look like? It means a healthy, just food system economic development, environmental health, and community health. And community health includes everything from our daily nutrition behaviors to making sure that people have a healthy mindset, that they're able to be in an environment that really supports them living a healthy life, that workers are paid, again, fair conditions, fair prices for their wages. And so just to break that down a little bit and really take a look at the comprehensive approach that we're really trying to take in the food system, I wanted to break it up by the individual areas I mentioned. As far as worker health, our current food system isn't really contributing to a healthy environment. Pesticide usage in our current food system contributes to many health issues a year. I believe it's in California alone. We face these issues all the time. In San Diego in 1999, which is the last numbers I could find for this, we were 12th in the state for the number of cases of pesticide poisoning in California. Our meat processing facilities, if many of you have seen Food Inc. and read Eric Schlosser's book, you know that we're trying to speed up the system constantly. So there's many farm injuries that are worker injuries that may or may not be reported. Our CAFOs, which have a high use of antibiotics, about 70% of the antibiotics in the United States are actually used in animal production, and that is to prevent disease since they're in such tight, confined spaces. So this is causing a lot of the antibiotic resistance. So even though healthcare professionals are often being blamed for this, it's out of their control unless we stop using it in our meat supply. And this is also leading to high antibiotic resistance rates in those who are actually employed in the meat packing industry, as they're picking it up from the work that they're doing on a daily basis. When it comes to health statistics in farm workers, you'd probably be shocked to find out that 80% of males employed as farm workers are overweight or obese. And for women, it's 71%. So what's happening, I just talked to someone last weekend and they were telling me how they knew someone who worked in a salad bowl in California, and although they were producing lettuce and spinach, it was being shipped out before they ever had a chance to access it. It was being processed and then shipped back into their community. So they're never touching the food that they're growing themselves, and often they're paid low wages and aren't able to purchase the food once it's back in their community. As far as food safety goes, again, confined animal feeding operations like CAFOs, the waste management practices, unfortunately, it's producing more waste than we can really dispose of. So what's happening is, for example, on a pig farm, pigs produce about 4 times the amount of waste as humans do in a day. So if you have a farm that has 5,000 pigs on it, that's about 20,000 times, or about 20,000 times the amount of waste that we're producing on a daily basis. So it's getting leached into the water, it's getting leached into the soil, and it's having an impact on our food safety. You've probably heard about the spinach recall a couple years ago. A lot of that was from the local animal feeding operation. It got into the water supply. The antibiotic use and the pesticide use that they were using got into the water supply, contaminated the spinach, and then we had an E. coli breakout. Again, this also goes to highly centralized food production. Whether we're growing our food in mass production or we're processing it in mass production, we're really putting our nation at risk. Because one, there's terrorists, if you want to take it to that level. It's putting us at higher risk for terrorist threat. If we have less meat processing plants, I think we have about 13 in the United States that are USDA sealed and approved. So there's one centralized, if someone wanted to do some type of damage, there's only one facility that they would really need to get into. That's drastic. Also, what's happening is that, as many of you are familiar with in your meat production facilities, is that your hamburger is made out of 1,000 cattle opposed to just one. So really pinpointing where the source of contamination took place is very complicated.